Almost everyone can relate to walking into a room but forgetting why you're there. Trouble finding a word when telling a story, and certainly remembering the name of that one coworker. But we justify it. I'm not being mindful. I got interrupted and lost my train of thought. And that coworker works remotely half the time anyway. How do we tell normal brain blips from legit degenerative concern? My next guest earned his MD from Duke University Medical Center and served as chief resident in neurology at the University of California. He's now a neuroscience researcher and internationally recognized expert in the mechanisms of neurodegenerative diseases. Through his research and clinical experience, he's developed proven protocols that challenge the learned helplessness of brain aging. Today, he's going to help us challenge the impossible as we ask the question, is Alzheimer's inevitable? This is the Curious Introvert podcast with me, Meredith. Around here, we explore taboo questions and societal blind spots. My mission, and yours if you choose to accept it, is to inspire curiosity by exploring the nuance and paradox of our world. Please help me welcome the man pushing back against false hopelessness, paving the path for brainspan and health span, Dr. Dale Bredesen. Thanks for being here.
Thanks so much, Meredith. Great to talk to you.
I am so excited to dive in. I've been loving your book, so I want to get right to it. Is Alzheimer's a death sentence?
Absolutely not. And in fact, we are just finishing a randomized controlled trial at 6 different sites around the U.S., and we are seeing better improvements than have ever been published previously, with huge impact from the protocol that we've developed. So absolutely, we see it. And of course, the earlier you start, just as for cancer, the big point is get in early. Don't wait, get early testing. The same thing for heart disease. Don't wait to have a heart attack. Get a calcium score for your heart, etc. And it's no different for cognitive decline. And the good news is there are some wonderful blood tests now that weren't available even 2 years ago. There are several of them. The most sensitive are by a group called Neurocode, and you can get these at getabrainscan.com. And you can actually get these direct. If you're before 60, you want to do it every 5 years, so you don't have to do it very often. See where you stand, and that way you'll tell you. We recommend start at 35, 40, 45, 50, 55, 60, and then every 2 years after that. That's the way we deal best with all of these complex chronic illnesses, whether you're talking about heart disease, cancers, diabetes, metabolic dysfunction, or neurodegeneration.
Okay. What's so different, though, about what you're saying is 2 things. For one, we don't usually think of Alzheimer's as something we should prevent. And 2, when we talk about these early screenings for heart disease and cancer, they very much feel like a sales funnel. Do you know what I mean? Like the screening's like, okay, now we get to put you on this medication because you have pre-diabetes. But your approach is so different because you're talking about lifestyle changes that support optimal health instead of kind of the learned helplessness that we get from the pharmaceutical model.
Yeah, that's a really good point. This is a new era. Things are really changing, and it's because in the past, there has been nothing that we could offer. So people would say, well, don't bother to check. They would say, don't bother to check your genetics because there's nothing you can do about it. And in fact, we now know that there's a tremendous amount you can do about it. There's a whole website, apoe4.info, started by one of the patients, Julie G., who's a ApoE4 for herself. That's highest risk for Alzheimer's. Had early symptoms, has done well. She's now over 13 years doing the right things and having no problems. She took her scores from the 35th percentile to the 98th percentile. So she is brilliant. She's doing great. In fact, she wrote a part of my second book. She wrote the handbook part of that. And the website has over 8,000 people who are all ApoE4 positive at risk. And they're, most of them on some variation of our protocol, and most of them doing very, very well. So it is a new era. And you're right. There's always this concern about, well, is this really good for me? But there's no question, looking at your cognitive changes early, very helpful. If everybody starts early, there should be very little dementia. Just like when you develop a cancer, you go through stages where it's, less malignant. You can start with a benign tumor. It can then develop additional mutations and become a more malignant and then a metastatic tumor, et cetera. It's the same sort of thing when you have cognitive decline. You go through 4 phases. So in phase 1, you're asymptomatic. And the good news is you can even pick things up then and say, okay, you're feeling great, but let's keep you feeling great. We've never had a single example of someone who started when they were asymptomatic, got on the protocol, did things right, and yet developed dementia. So that's a very successful time to start. The second phase is called SCI, subjective cognitive impairment. And by definition, what that means is you know something's not quite right. You're not remembering things the way you used to, or you're not having other cognitive things. You know, you may occasionally get lost, or you may do other things. You may have trouble with figuring out a tip, for example, that you didn't have trouble with before, that sort of thing. People often will say they don't recognize faces the way they used to. These are all kind of earliest signs, but you're still able to score normally on cognitive testing. So by definition, that's called SCI. And again, the blood test will already pick it up and say, oh yeah, you're in the earliest changes and great time to get in. That lasts, interestingly, on average, 10 years. So the window of opportunity for all of us is huge, which is why I recommend just get checked every 5 years, because it does sneak up on you. We had one woman who came in and said, you know, this runs in my family. I'm concerned. She had a single copy of this ApoE4 allele that is the common genetic risk. And she said, but I think I'm okay. And I actually mentioned her in the book. Her MOCA score was only 23. So she was already well into the 3rd stage. So in the 3rd stage, MCI, mild cognitive impairment, and it's too bad they chose the term mild, because as one patient said, there's nothing mild about it. This is where you really are struggling, and now you're scoring abnormally on the cognitive testing, but you're still able to care for yourself. Your activities of daily living are fine. You can drive, you can balance your checkbook, all those sorts of things. Each year, 5 to 10% of those people will now convert to the final stage, which is the 4th stage, and that's called dementia. And that's where now you are starting to have trouble with your activities of daily living. And of course, that's what ultimately leads to not being able to care for yourself. So the great news is we get in early. Everybody does very, very well. Now, in our trials, because we're matching them up with the drug trials, we're only looking at the last 2 phases. We're looking at MCI, mild cognitive impairment, and early stage dementia. And even then, 84% of the people improve their scores. So you can see that even then, there's something you can do, but it's much easier and more complete. But again, we're seeing things we've never seen before. As an example, there's a very, very sensitive test called ASL, arterial spin labeling. It's one of the things you can do on an MRI. And this is something originally suggested by Dr. Cyrus Raji, who is a superb neuroradiologist from Washington University. We work with him in our trials. And so ASL is very sensitive to show you decreases in blood flow in specific regions of the brain. For example, one's called the precuneus, as an example. One's called the posterior cingulate. These are regions of the brain that tell you, this is Alzheimer's. So he recently showed a person on our protocol who had a clearly abnormal ASL, Alzheimer's. This is an ApoE4/4, so highest risk, has the problem. He's working, he's using the protocol, he's getting better. They repeated a year later, his ASL, completely normal. So these are things that, people would have said were impossible just a few years ago. And yet we're seeing these wonderful results time after time after time now.
You mentioned the MOCA test. That is the self-assessment of 30 minutes, right? Or 30 questions, something like that, where you can take that online, although it's ideal to take it with a trained psychologist.
Yes.
Do I have that right?
That's correct. So it's the Montreal Cognitive Assessment developed years ago. It's really targeted for MCI. So for the people who have SCI, it's probably a little too easy for you. And the people who are asymptomatic, most people should score out of a 30-point scale, 28, 29, or 30. They claim, down to 26 is normal, but most people who are scoring 25, 26, they're already beginning to have some problems. So it's good for picking up MCI. For picking up even earlier on the SCI, there are some online tests that are even more sensitive, such as the one we've used in the trial, which is CNS vital signs. That's a very good one, but there are other good ones. There's Cambridge has one, and there are a number of others. That whatever you use, get an idea of where you stand because you want to get a baseline. You want to see, am I starting to slip a little bit? One of the problems is that this sneaks up on you.
Yes.
And so people will keep saying, oh, I'm probably okay. I'm probably okay. And we talked about this in the book as well, that, probably okay, just as you said, you explain away these slips, but you know that something's not quite right. And in fact, what's really great to see, when people then get on appropriate treatment, they notice the difference. Like, oh my gosh. One of the guys said to me, his wife got in the car and he said, oh, I forgot exactly where we're going. She's like, no, here, this way, turn left. And she was fairly far along and she's done great. Left, right, left, right, left, right. I know exactly how to get there. And you can see these, improvements. So you'll notice as things get better.
Well, I mean, if I can just go into the bathroom at the mall and come out and go the correct direction, I would get really excited. But I want to ask you more about this self-assessment because so many people experience some sort of state of neurodivergence, right? ADHD, autism, audio processing disorder. So for those people, how do you recommend that they maintain awareness without confusing their baseline with signs of degeneration?
Yeah, that's such a great point. And it's very simple. There is a very sensitive and excellent and free online test. Just go to mycqtest.com, free test, and it'll show you, where do you stand. And that one takes about 20 minutes.
Okay.
So very, very easy. The MOCA, just as you mentioned, it's good to have someone who has already certified in giving the MOCA test to be giving that. And it's pretty straightforward. And that one scores, as I mentioned, up to 30. It's got some memory components. It's got some executive functioning components. It's got some verbal components. So it's kind of sampling different areas to see. But it's not terribly sensitive in that it was specifically designed for MCI, not SCI.
Yeah, that second stage up. This question comes in from a listener, and she wants to know, what are the similarities between Alzheimer's and Parkinson's, and how often do you find these are misdiagnosed?
Yeah, this is a really important point. I'm so glad you asked it. Because all of these things, just as we think of, cancers, you can have cancer of the pancreas or cancer of the esophagus or cancer of the breast or cancer of the whatever. You can have so many different things. They're all cancers, though. It's the same fundamental problem. You have too much oncogene and too little tumor suppressor gene support. So you are driving this production of more cells. Neurodegeneration, same idea. What we discovered in the lab, and we had a lab for 30 years looking at the fundamental nature of neurodegenerative diseases at the molecular level, what we discovered is that these are all network insufficiencies. So in each case, what happens is you have several things that are critical for supply, and then you have demand. And when you're young and healthy, good supply, not so much on the demand. As you get a little older, or if you have specific genetics, the supply is starting to drop. The blood flow is decreasing, the oxygen saturation, the mitochondrial function. And at the same time, the demands are actually going up. Now you have some inflammation. Now you have some toxicity. You got to detox. And so you pass this point where instead of making and keeping connections, you actually are pulling back. And you are, what we found, which was very interesting, is you're switching from a connection mode to a protection mode. And you can see that at every level, at the molecular species, at the cell level, at the tissue level, and your organ and the entire organism is switching over to this protection mode. Now, Alzheimer's versus Parkinson's, there's something called antagonistic pleiotropy, which means as we all evolved, we continued to select for performance over durability. And of course, the organisms that selected for durability were killed by the ones that selected for performance. So we have these amazing, amazing brains. We've been selected to do this stuff. So for example, you can remember more, you can store more in your brain than over 2,000 home computers. I mean, imagine 2,000 home computers. It's incredible. At the same time, you have this unbelievable ability for motor modulation to play the piano, to play a violin. I mean, check out Simone Biles. What she can do shows what a human being is capable of. These things take energy. They take fine tuning. So you have one system for memory storage, for neuroplasticity. When that one is not supported enough, you develop Alzheimer's disease. When the motor modulation one doesn't give you that fine tuning, you develop Parkinson's. So there are two different examples in which the supply was exceeded by the demand repeatedly or chronically. And you can now trace it down to what caused that. And there are many things, which is why we look in Alzheimer's at these many different things. In Parkinson's, the major point here, the fundamental nature, is that mitochondrial complex 1 is the rate limiting step. You have to have very high functioning mitochondria to get this fine motor modulation. And you can mess that up in a number of ways. You can do that from various organic toxins, being exposed to TCE, trichloroethylene, PCE, DDT, paraquat, all these things reduce that function of the mitochondria until it's now interfering with your normal movement. And so what happens, you can imagine this, if you don't have that fine modulation, you can't run as fast. You are tripping and falling. You have more falls than you should. You're not as steady as you should be. You can't hold still. You got this shaking going on. When you put your hand at rest, you have what's called a resting tremor. So these are two different examples in which these neural subsystems are now failing. And so they do look quite different because for Parkinson's, of course, you're talking about motor modulation, fine tuning. And so these are people who have problems with motor functioning. Yes, they can ultimately develop some dementia, but if that comes first, it's Lewy body disease, not Parkinson's. For Parkinson's, it's the motor. And interestingly, before you get to the motor part, you'll often have a triad of things. You'll have some constipation because you don't have that normal enteric nervous system. That part of the nervous system is failing as well. Secondly, you'll start to lose your sense of smell. So you'll get anosmia. Again, very common. If you've lost your sense of smell, get checked out because it's an early warning sign. And then the third thing is called REM behavioral disturbance. This is where when you go to bed and you start to have dreams, you start flinging your arms around because normally your brain has this beautiful system. When you start to dream, it turns off your ability to move your arms and legs. And so you're paralyzed while you are dreaming. And it's a beautiful system. But when that system starts to fail, now you start to have the dreams and you're flinging things all over the place and you're knocking your spouse. And so that's a relatively common thing. And it says you are on the way to Parkinson's. So take note if that happens to you, please get evaluated because, again, getting in early. There's some wonderful work by Dr. Dorsey and his colleagues pointing out how important this toxic exposure is. The other thing that's come up, as you know, is that the gut microbiome is altered in Parkinson's disease and Alzheimer's in different ways. And so specific species in Parkinson's, one called desulfovibrio, for example, which is increased. Another one interesting is some of the Clostridia species. And these actually produce a toxin that interferes with your dopamine metabolism. And this is thought to be important potentially in autism spectrum disorder as well. So we're learning more and more and more about how the body interacts from your gut to your brain, your oral health, all these things, your blood pressure, your sympathetic drive versus parasympathetic. These all come together to impact these neural networks. And again, what's happened is they're so finely tuned that when you start to fail, fairly early on, you'll notice something's not quite the same. Baseball players have to retire because they don't have the fine movement as they hit 35 or 40. There have been changes now that have been picked up, just the beginnings of future Alzheimer's in the 20s. So we're understanding these better. And in so doing, we're able to prevent them and reverse them like never before.
So for somebody that suspects that they or their loved one may have been misdiagnosed with
Yeah.
Alzheimer's or dementia, when in
Yes.
fact it's actually Parkinson's, would your protocols still apply?
Absolutely. Now, if it was misdiagnosed as Alzheimer's, it's likely to be Lewy body. If it looks like Parkinson's, but it started out as cognitive change, these Lewy bodies, when they are collecting, when you have the abnormalities, mostly in the brainstem, that gives you Parkinson's. It's the substantia nigra, it's the part of the midbrain. On the other hand, when you're getting them throughout your cortex, throughout your brain, then that's called Lewy body disease. And you can have some Parkinsonism with that, but that is a different thing. And yes, our protocol has worked very well for Lewy body disease as well as Alzheimer's. Again, the earlier the better. And when you do have that Lewy body disease, you really want to work with your practitioner. We've trained over 2,000 practitioners now, 10 different countries and all over the United States. And they need to look very deeply at the toxicity. As I mentioned, these diseases, these Lewy body related diseases, which are Parkinson's, Lewy body, and something called MSA, multiple system atrophy, they make what's called synuclein. And this is something that's there as an antimicrobial. This is trying to fight these various things you're exposed to. And when you have that, you typically are finding that your mitochondria are compromised due to specific toxins. And these come in three groups. It's the inorganics, things like air pollution and mercury and things like that. It's the organics, and the organics especially when you look at someone with Parkinson's, the organics are things like paraquat, and I mentioned earlier TCE, PCE, dieldrin, DDT, anesthetic agents, microplastics, unfortunately, have now been coming on as a relatively common neuronal damaging agent as well. Glyphosate is another one. So that's the organics. And then the third group is the biotoxins. As you know, it's turned out that mold species, especially 5 or 6 molds, it's the Stachybotrys and Penicillium, Aspergillus, Chetomium, Wallemia, and Fusarium. Those are the bad guys. There are lots of other mold species around, as you know, that are typically not giving you neurodegeneration. But those are the bad guys, and those are the ones you worry about. What they're trying to do, they're trying to survive by making things like penicillin that will kill the bacteria that grow faster than they do. But in so doing, of course, what comes from bacteria are mitochondria. So our mitochondria, unfortunately, still have a lot of look like bacteria. And so they get damaged by these things as well and end up that they can give us from the mycotoxins, Parkinson's, Lewy body, Alzheimer's disease, things like that. So absolutely get in early, get to someone who's a good team, who's got a good team, and keep things, this is a new era again. This is not the old idea you write a prescription. It doesn't work. It's not that simple, unfortunately. You want to optimize the various players that are driving this neurodegenerative process.
Well, I think that I love your optimism that it's a new era, but for at least, we're in the Florida Panhandle. And I can tell you that most of the physicians that I've come in contact with are not able to practice in that way. They may want to, I don't know, but they're just not set up for that. And so do you have any suggestions for people who are trying to really be proactive towards their vitality, or caretakers who are trying to help loved ones? Like, should they go to people like your wife, an integrative physician, or a functional medicine doctor, performance anti-aging doctor? Like, should we just skip over that traditional framework and change our expectation to be a cash-paying patient?
Yeah, this is a really critical point right now because we are in the middle of this paradigm shift. We're in the middle of this, as you know, this upheaval in medicine. The medicine that I was taught 50 years ago in medical school is really outdated now. This idea that we're going to make a diagnosis, we're really taught, to look for the what. What is it? Is it Alzheimer's? Is it not? And then I was going to write a prescription for something or send someone to surgery. That is way outdated now. We do much better by asking why. What happened? Did your gut microbiome change? Do you have a genetic predisposition to this problem? Mostly these things work together. You have some genetic predisposition, you have some exposure to something, and then your lifestyle also adds to this. And everything together is a problem. It's too much now. You're overburdening the system that you're born with. And so now you're pulling back, you're switching, as I said, to that protection mode. You're trying to fight these various insults, whether it's changes in oral microbiome, chronic sinusitis, leaky gut, so many other things. So you're right. The big problem is today, if you walk into a doctor's office, for most people, it's a disaster. They just say, yeah, you've got some problems. You may develop Alzheimer's. We don't know. We don't know what causes it. We don't know what to do about it. We'll give you a drug and it's not going to work very well. I mean, that is just so sad when there is so much that can be done. So I would encourage people, number one, ask your doctor to take some training. There's something called Recode 2.0 training that looks at all the different pieces that are driving this so that you can get best outcomes. And this is what's led to the best outcomes to date. Secondly, you can take some training yourself. You can take that, and we've got a number of fantastic experts. Dr. Anne Hathaway on BHRT and on hormone replacement. Dr. Cyrus Raji, I mentioned earlier, fantastic neuroradiologist. Dr. Neil Nathan, who's the world's expert on mycotoxins and chemical sensitivities and things like that, along with Dr. Shoemaker, so also a world's expert on mycotoxins. So there are tremendous people who can help teach this to help you get best outcomes. But you're absolutely right. We're hoping that in the near future, it would be part of standard of care and it would be reimbursable and it would be simple. You just go through this. I do think, though, of all the investments that you can make, investing in your brain health is one of the best. The point of the book is we should all have a brain span that is at least as long as our lifespan. Because if you're going to have, everybody's met people who live till 80 or 85 or 90, but their brain only works till they're 70 or 75. Yeah. That's a problem. So we want to give you we want to make sure that your brain span is just as long as your lifespan.
Yeah. And I think there's an under-recognized emotional investment when it comes to pursuing vitality for ourselves. We go to a performance medicine doctor and they take, we've been very happy with them so far. Very holistic approach to the lifestyle side of it, but also the traditional side of it. Like they just run a nice middle and they seem to ask really great questions, which of course is a podcast, I appreciate that, the curiosity and asking the why. So I love that you brought that up. But because we have limited emotional resources to care for ourselves, we might like the idea of investing, but when we go to our, doctor who maybe doesn't really buy into lifestyle medicine, or as you pointed out, he may just not be trained, she may not be trained. Right. Yeah. We get frustrated and then we just, throw out the baby with the bathwater because it's too much. So that's why I like your book. That's why you have more than one, you have many. So, but I like that the empowerment that you're communicating in that. And so I want to get your hot take next up on some maybe myths, we could call them. Maybe they're I don't know, true, false. So maybe just answer true or false as I go down some of these. Okay, so true or false?
Sorry, before you start, I just want to mention, and if you do one thing right, that's better than zero. Yeah. We all see these changes. Just becoming metabolically flexible makes a difference. Just getting rid of some of the inflammation. So it's great to have doctors who talk about lifestyle. But then when you need something which is not being identified there, oh my gosh, you do have mycotoxin exposure, or you do have an occult abscess that's going to be picked up by cone beam CT. You want a doctor who knows what they're doing when they need to kind of bring in the next look. So, okay, I just wanted to make that point, because there is, even if you only do a little, that's better than nothing.
Yes. And I'm so glad that you brought up the mycotoxin thing, because that's been a part of our journey. And it's something that no one talks about. We talk about, you hear about diet and lifestyle, but no one
Yeah,
talks about detox unless they're
so
like selling you
important.
essential oils. You know what I mean? So
Yeah,
like
yeah,
it's
so
hard. We
important.
just sweep it under the rug as nonsensical, but I'm learning so much about mold right now. It's bananas, but that's a different podcast for a different day.
Yes, I
So
got you.
yeah.
Okay, true,
Okay.
false.
True,
Okay,
false, true, false. Okay. So true or false, Alzheimer's is 100% genetic.
absolutely false. So it's been pointed out it's less than 5% of the cases are truly dominantly inherited. Now, there's a genetic proclivity, so you're more likely to get it. But as an example, those of us who are zero copies of ApoE4, and everybody should know their ApoE status. Zero copies, that's three-quarters of the population. You have a 9% risk during your lifetime. Not zero, but it's not too high. Single copy, 30%, that's 75 million Americans. Two copies, that's 7 million Americans, 90% chance of getting it. Nobody should get it. Find out where you stand. Get on active prevention.
True or false,
Okay, next.
prolonged Benadryl use can contribute to development of Alzheimer's.
Yes, it's one of the many risk factors. And unfortunately, it does have this anticholinergic effect, and your acetylcholine is critical for memory formation. So things like benzodiazepines and anticholinergics, including the Benadryl, these are all risk factors for cognitive decline.
Not flossing can contribute to Alzheimer's.
So it turns out that your oral microbiome is very important. And of course, now there are oral probiotics and oral prebiotics and some excellent rinses and things like that. Stella rinses is one, for example. We've also used things like a dental sidin in our trials. So having a nice oral microbiome is quite good. And having, P. gingivalis in there, T. denticola, these pathogens, these do communicate with your brain. The brain microbiome, amazingly, has many organisms that are oral microbiome organisms.
That's just so cool. It's everything's connected, like that old
Everything
song.
is connected.
Okay,
Yep.
true or false, statin drugs can contribute to cognitive decline.
So this one is much less clear. So here's the thing. They have a positive and a negative. So that when there have been multiple statin evaluations associated with cognitive decline, some of them have shown that they inhibit cognitive decline, they reduce risk. Some of them show that they enhance. And the reason seems to be because they do both. So it depends on which one wins out in your case. So those are like a fourth level. Start with your diet, exercise, some basic things. You shouldn't have to be on them. By the way, in our trials, a number of people no longer need their statins. When they do the right things, they just don't need these. And so if that doesn't work for you, then consider adding something like bergamot, something pretty simple. And then if that's not enough, then consider adding something like Zetia, which reduces the absorption without using statins, because statins do have some negative side effects. Yes, they can reduce the inflammation, which seems to be the good part, but they can also reduce the support, the lipid support that you need in your brain. So that's why it's not been so clear. And then if those don't even work, then think about things like PCSK9 inhibitors like Repatha, those things. So with something you can get it, but don't I see people all the time who are over statinized. You don't want to go too far. So yeah, that one's not really a true or a false. It's a both.
I love that. Last true or false question for causes. Eating foods cooked with vegetable or canola oil can contribute to cognitive decline.
So seed oils in general, yes, have been associated with some cognitive decline. You want to have things like avocado oil and EVOO and oils that are healthier. These other ones, for one thing, things that are heat prepared can be a problem, and they tends to get rid of the vitamin E, for example, the antioxidant in there. So yeah, it can be a problem, and that we can do better in terms of what oils to use. Now, some people argue don't use any oils because that's still a processed food, but the studies in general have not shown that to be a problem.
I want to move on to solutions in a second, but before we do, I want to talk a little bit more about mindset because
Yeah.
with all these ways, that was part of my list. That was just half of it.
Yeah.
There's so many ways that one can acquire cognitive decline. It's easy to see it as an inevitability. And I feel like there
Yeah.
is You know what bystander effect is? When like someone in public is having an
Yeah,
emergency, there's a bunch of people around who could potentially help that person who's having an
yeah,
emergency, and yet no one does. That's bystander
right.
effect. Alzheimer's is such an extreme version of it in our mind's eye, but like those smaller things
Yeah.
that I mentioned in our intro, like losing facial recognition, forgetting the person's name, all of that, I think has this potential for a medical bystander effect in which we do not help ourselves
Yeah.
because we see it as, oh, someone else will help me with that when it's real bad. How do you overcome that with the public? Because notably, the people you're working with are, you know, probably people that are like ready to do the work. But for the other ones, like there are those people you don't even talk with. So, yeah.
So this is a really good point because people have been trained to say that there's nothing.
Right.
And so they literally push back when we say, look, here are the data. Here are published papers. Here are published trials. Look at these people getting better. They say, oh, but we don't believe it. We want a bigger trial. We want this. So there's always, wherever the bar is, they want it to be, they just put it higher. Oh, so now we did it. So initially we had some anecdotes at the beginning. This was now over 10 years ago. And we published the first examples of reversal of cognitive decline in Alzheimer's disease. Then people said, well, those are just anecdotes. Okay. Then we published 100 of them. Then they said, no, you need a trial. Then we did a proof of concept trial, which was very positive. Then they said, no, now we need confirmation. Then Dr. Heather Sanderson did her own trial and got the exact same results we did. Then they said, oh, that's not good enough. We want a randomized controlled trial. So, okay, now we're finishing a randomized controlled trial. We already have 95% of the cognitive data, and it shows better results than have ever been published before. Then they're going to say, well, we want to have more people. They'll often point out, well, these drug trials are, 1,500 people. Well, you need 1,500 people because the effect size is so tiny. That's why you have to do this. So these trials cost $50, $100 million. You don't need to do that if you have a big effect size. And so, we're doing currently 72 patients. And it only took about the first 40 to show that there was a statistically significant effect. So it is so important for people to understand this. And you're absolutely right. There is this idea, and it's amazing to me. My colleagues, the neurologists that I trained with, will say, no, you can't do this. There's nothing that could be done. The other thing that's so fascinating, you can see what drives things. So in the past, people said, you're seeing it early. That's not Alzheimer's. That's too early. Then so we're saying, well, look, get in early. There's so much you can do. You'll never get Alzheimer's. Then drugs came out that will remove the amyloid. So then they said, oh, okay, now we're going to say that everything is Alzheimer's as soon as you begin to see that amyloid, which they've never said before. But now they're saying, oh, so now it's because we want to give you the drug earlier and sell more drugs earlier on. The problem is that the drugs don't improve you, and the drugs actually have some very significant side effects. Brain microhemorrhage, brain swelling, and in some cases, death. Luckily, very few cases, there's actually death.
Yeah.
But those are significant side effects. And so my argument is, for about a quarter of the cost of these expensive drugs, you can have 6 times better the outcome. That makes a lot of sense. Why spend all of this tremendous amount of money for something that's really not helping? So that's where things stand.
And to be clear, like when you talk about cost of these drugs, I mean, it's like $50,000 a year versus like $10,000 or $12,000 a year, which I have heard people pay that to send their kid to like prestigious kindergartens and preschools.
Yeah.
So like, I just want to make sure that we don't leave those numbers in the unknown. Like those are tremendous numbers. So let's talk more about what those things that are working, but let's do a quick true, false session again. We'll make it a game segment. I'll insert some game music or something. So true or false, ketone supplementation can help with cognitive impairment symptoms.
Absolutely. That's been published. Professor Stephen Kinane from Canada did a study where he just used ketones. Now, we would argue you want to look at all the things that are driving the problem. Don't just do one thing. But that's part of the energetics. Your brain uses glucose or ketones, and it needs to go back and forth. And in most cases, when people have cognitive decline, they've lost the ability to do both. They're insulin resistant, so they're not using their glucose well. And because of the high insulin levels that respond, it prevents you from making ketones. So it's a mess. You are literally sputtering. We want to return both of those. But yes, Dr. Kinane's studies showed that even just giving ketones can improve cognition.
True or false, cold plunges can help?
Absolutely, because this is the Wim Hof method, of course, and this does increase mitochondria. So you're making more mitochondria. You're basically pushing your mitochondria to function better. So just like it's one form of training.
True or false, nootropics are worth the money?
It depends on how much money you're spending on them and which ones you're using. So that's the key. But yes, there are all sorts of things that, as I mentioned in the book, The Ageless Brain, that you want performance and protection. It's easy to get performance without protection for a short period of time. Take some cocaine. Your performance will go up for a period of, that'll work. So you don't want things that are basically mimicking cocaine.
Yeah.
Some of the patients will take some Adderall or Ritalin just when they have a meeting to go to, when they want to be at their tip-top best. But that's not a chronic solution. At the same time, protection without performance, you can buy one of those liquid nitrogen tanks, cut your head off, put it in the liquid nitrogen tank. You're never going to have neurodegeneration, but you won't be very happy with your performance. So the whole point of the book is you want your best performance with the best protection. And therefore, yes, you want to optimize your metabolic status, your inflammatory status, your toxic status. And yes, some of these nootropics, no question, can be helpful.
Psychedelics as a way to reconnect neuropathways.
Yeah, this is a very interesting area. And of course, you get to these things where it's a fad and everybody wants to do them just because it's cool and everyone's doing them. Well, the important data here are that, yes, this can enhance neurite outgrowth. So I do think in the long run, and there are ongoing studies on this, in the long run, what's going to happen is you take people, you start and you improve their metabolic status, their toxic status, you get them to their point, and then they may plateau. Now you want them to be able to make new neural pathways. Now you want to introduce, take it slowly, you want to introduce the psychotropics. And I think that there, in the long run, is likely to be an important role for these. But again, just the idea of that alone, starting with that, not minding the basics is important. The basics, people think, oh, it's boring. But no, these are critical pieces to make your brain function better. And it's so great to hear people say, oh my gosh, I'm remembering things like never before. I have energy like never before. I recognize faces. One of the early people who got on this, Deborah, who was in one of the earlier books, is amazing. She's a brilliant lady, spoke Chinese and Russian, both of which she lost, both of which she was starting to get back. She got back the ability to play the piano. And, she just noticed she was driving along the road and she said all this Chinese started to just come tumbling into her brain again.
I love that.
So it's just great to see people getting things back.
Yeah.
And it definitely helps to make sure, if you're going to put a house up, make sure you got a good foundation. And that's what we want to do here. So I do think there's a role for psychedelics.
Yeah. Well, I think the reason people get bored with what you're calling the basics, which we will cover because they're not that basic, but the reason that people get bored with them is I think we have heard them in such general and vague terms that we're like, cool, what do I do with that? Diet and exercise. All right. But what I love about your book is you actually get really specific, but you also point out, I think inspired by kind of a type A patient that came through your program, that, it isn't all just like formulaic. There is some, being in touch with your own body and your own mind. And the second thing that I wanted to say was in response to getting things back that I can attest personally. I went through a difficult time many, many years ago and took an antidepressant for about 3 months. It was called Wellbutrin. And I had an amazing memory prior to that. Like so sharp, could remember people's names, details about their lives. I worked at Kmart and for a while, and I would remember customers would come in. I go,
Yeah.
Stacy, good to see you. That vacation with your cousin Bob in Hawaii,
Yeah.
how did that go? And they would,
Yeah.
it freaked him out. It actually wasn't that helpful. But the point is that was my before, and then I took Wellbutrin, and it was just garbage.
Yeah.
And what's amazing now is it's like it's coming back. And
Hmm.
and that was a long time ago. That was like 2006. But through this podcast, I have found that my mental acuity is sharper. Like I
Yeah.
can understand things I couldn't before. I feel like really up there concepts I can grasp. And, and I'm 42. So
Yeah.
I don't think that it has to be a young person's game. And so, yeah, so I just wanted to throw my own testimony in there
Yeah.
for those people out there that feel discouraged because it is possible.
And we're seeing people continue to make gains years and years into starting this, which is so wonderful to see.
Yeah. So let's talk about, screen time. Let's talk about screen time real quick before we get into diet, because
Yeah.
Carlos Whitaker, have you heard of him?
I don't know, Carlos.
Oh, this would be so fun to connect the two of you.
Yeah.
Carlos is a multi-platform person, but he recently wrote a book called Reconnected. But he spent 7 weeks without any screen time, did a bunch of things out,
Yeah.
out and about. But he tested his memory with a neurologist before and after. And he went from a low percentile of cognitive ability to a very high percentile of ability just by not having a single screen, no TV, no phone, no tablet, no
Interesting.
nothing. And so I wonder if that's at all a part of your protocols for your patients.
I certainly heard this story before. I did not know it was Carlos.
Mm-hmm.
So the problem here is, again, there are so many factors that are involved here. We use this screen time for connecting. Obviously, podcasts and all these sorts of things are critical. We use it for doing so much of our work. But there are negatives, of course. And of course, we get some stimulation from it. But we're learning things. You can look up things like never before. With all the AI and Chat GPT and all this, you're able to get answers that would take a while in the past. At the same time, you have to be careful. And one of the things it can really interfere with is your circadian rhythms, of course. And so you want to either put your blue blockers on or do the screen dimming at night. You want to make sure that it doesn't damage your circadian rhythms. And so, yes, you're right. Used appropriately, it's a real positive. Used inappropriately, it can be a significant negative.
Okay, let's talk diet because this is really interesting. We are going to demystify the diet part as it relates to brain health protocol. You said in your book that if there was one big bad boogeyman, as you put it, it is sugar. So is there a threshold of either grams of sugar daily or grams of carbs daily that should be our target that we're going for?
Yeah, great point. And, I was working with a guy recently who found out that he was ApoE4 single copy, and he had some significant metabolic issues, was overweight, was borderline diabetic, did not realize he was having cognitive issues. So we checked his cognitive score, 10th percentile. So a couple of months later, went on what we call KetoFlex 12-3. It's a plant-rich, mildly ketogenic diet. Lost weight, improved his blood pressure, improved his lipid profiles, improved his hemoglobin A1C, and now his memory percentile, there's cognitive test, same cognitive test, 10th percentile, 91st percentile. Wow. So yes, it makes a difference. And arguably the most important and most common risk factor in the United States for cognitive decline is metabolic dysfunction. There are this is what's leading to prediabetes. It's what's leading to metabolic liver disease in so many people. It's what's leading to insulin resistance, high hemoglobin A1Cs, ultimately prediabetes, and then full-on type 2 diabetes. This is a huge problem, and optimizing that metabolic function makes a huge difference. As I mentioned before, typically you've lost, by the time you're in your mid-40s, and there are 100 million Americans with metabolic syndrome. which combines hypertension, some extra weight with lipid dyslipidemia, and some insulin resistance. This combination, metabolic syndrome, incredibly common. So if you look at these different mechanisms, you now lose the insulin sensitivity. Insulin is a critical factor. When we used to grow brain cells in the lab, which we did all the time in petri dishes, and when we would test them with all these different compounds and various molecular species, et cetera, and when we did that, we always had to include insulin because insulin is an important trophic support for brain health. And for most of us, then we begin to lose the insulin sensitivity, and we lose now the ability to make ketones. So our brains are sputtering. Our brains are a little bit like a Prius. They're like a hybrid. You got to have one of those two things. If you don't have either of them, you're not going to go anywhere.
Yeah.
And so definitely the approach that we've taken has, as I mentioned in the book, I list all these amazing mechanisms that you get from optimizing your diet. And people have talked a lot about Mediterranean diet and Mind diet. They're fine, but they don't give you that additional piece of being mildly ketogenic. But they do the other parts. So they're giving you the fiber and things like that. Now, you asked about sugar. You want to get as close to zero as you can. And I should mention, fructose is worse than glucose. So high fructose corn syrup is about as bad as you can do. And Professor Rob Lustig and Professor Rick Johnson, two colleagues and wonderful guys, brilliant guys, have pointed out that fructose is worse. It increases the advanced glycation end products far more than glucose does. So it's a real problem. But you want to keep it as close to zero. Now, typically the diet that we recommend is about, in terms of total calories, about 70% good fats, about 20% on the protein, and about 10% on the carbs, or even 15-15. But you want to be able to get yourself into mild ketosis. So, once a day, you'd like to get to 0.8, 0.9, 1, 1.2 in that region for your beta-hydroxybutyrate. So that's the goal. And you want to be metabolically flexible. So you've got insulin sensitivity. You can seamlessly go back and forth between utilizing the glucose and utilizing the ketones. That alone, fixing that metabolic problem, has a huge impact on your cognition and helps you often to get off the antihypertensives. You no longer have the hypertension you did before. Helps you to improve your lipid profile. By the way, that also gives you, having this plant-rich, mildly ketogenic diet is great for detox. You're now improving your microbiome. You've got your prebiotic fiber. You're helping to detox these things better. So it's amazing how beneficial that really is.
Those macros that you mentioned, based on my own experience playing with macros, I would think that'd put you at about 30 net carbs a day. Does that sound about right?
Yeah, that's about right. So 30 net carbs is going to give you about 120 calories, and you probably could go a little bit higher than that. You probably go a little bit, but yes, you're looking at making it so that if you're a 2,000 calorie, then you're probably going to get somewhere around 200, 250 of those calories. So you're talking about 50 carbs, something like that.
Yeah.
Because you're going to get these mostly as complex carbs. You're going to get them from your vegetables. So you want to have a plate that Mark Hyman and others all often show, lots of vegetables and then a smaller amount. And, if you can have, wild caught fish and pastured chicken and pastured eggs and grass-fed beef and all these sorts of things. You just don't want to load yourself up with toxins when you're adding the meats.
What about alcohol?
So this is an ongoing argument between my wife and my wife, who's a superb integrative physician, has taught me a lot, and she works a lot with Julie G, the founder of apoe4.info. They, for a while, said, okay, it's the top of the pyramid. If you want an occasional, a little bit, no problem. And I still think for many people, it does relax you, and it's helpful on the stress side. But we all recognize it does often get you out of ketosis. It's got some of its own issues. And of course, alcohol itself, it is a carcinogen. It is a dementigen. So it is a problem. My argument then is minimize it. If it's going to be, a glass once a week, it's probably not going to hurt you. You got to kind of decide where you're going to do it. Their argument is no, zero. Don't say that. So it depends on whether you want to listen to one or the other, but either way, you want to minimize it.
Okay, so talk to me about sleep because sleep is important. We've heard about sleep and brain plaque. What is our
Huge.
target for sleep? What kind of sleep should we be getting?
Sleep plays a huge role. And in fact, the cognitive decline impacts your sleep, and sleep impacts your cognitive decline. So unfortunately, you get into this vicious circle. So for sleep, we got 4 things. Get a wearable. It's so easy. Get a Oura Ring or an Apple Watch or Fitbit or Garmin, whatever you like. Get a wearable and track your sleep. And you've got 4 goals. Each night, you want to get at least 7 hours of sleep. You want to get at least 90 minutes of REM, very important for memory. You want to get at least 60 minutes of deep sleep, very important for detox. And you want to have an oxygen saturation of at least 94%. If you hit those 4 parameters, you're doing well with your sleep. If you're not hitting those, then let's find out why. It's been pointed out that about 80% of sleep apnea goes undiagnosed. So if there's any question, please, you can do this at home now. There are home mechanisms, or you can go in and have a sleep study, find out if you do have sleep apnea, or upper airway resistance is another syndrome, which just basically makes you secrete adrenaline repeatedly because you're sucking this through. It's like sucking air in through a straw. So optimize your sleeping. It will pay dividends for years.
So exercise, what moves the needle as far as improved brain function when it comes to exercise?
Yeah, I've heard so many people say that they notice it. I notice this myself. If I get up in the morning and do a bunch of exercise, I feel invigorated. I feel I'm sharper during the day. And if I don't, I notice the difference. So you're getting the aerobic side is giving you better blood flow, is giving you better oxygenation, is supporting your mitochondrial function. These are all important things for brain function. The strength training side, interestingly, is giving you more insulin sensitivity. That's enhancing that. And it's also communicating with your brain, and both of them are enhancing your ability to get into ketosis. So it's very interesting the way that the ketones actually have an impact on your brain's production of BDNF. There was some beautiful work out of Cornell a few years ago showing that these things actually molecularly will impact your histones and actually now allow you to produce more brain-derived neurotrophic factor, which literally is intimately related to Alzheimer pathophysiology and gives you a better situation with respect to your synaptic performance and synaptic maintenance. So no question, exercise is part of the overall protocol that gives you best outcomes.
And I would encourage everyone to get your book because you talk about the aerobic recommendations versus the muscle building recommendations, but you also point out the best exercise is the one that you'll actually do. So that's definitely a good recommendation. As we wrap up, I want to ask you about the caretaker part of this because we presumably the people listening to this, people that you're talking with that are buying and reading your book, they are interested in vitality. They're like, God, please give me another option other than a shrug in the doctor's office or a shrug from my peers who say, oh, because there is this social contagion element as well. Like when someone is experiencing a health challenge and we all shrug and accept it as normal, it becomes really a little bit more effortful to try to push back and be like, no, dude, you're 30, your knee should not hurt. For example, right?
Yeah, no, and it's an issue for so many people. As you know, younger onset obesity, younger onset diabetes, all these things happening like never before. Now, you're too young to remember, but for those of us septuagenarians, we remember that back in the 1980s, there was a song, Let's Get Physical, by Olivia Newton-John. And so now it's Let's Get Physiological. So, we need to have someone come on and say, look, let's get physiological. We need to look at these things that are critical. And as you mentioned, when it comes to caregiving, what's been shown is caregiving is a risk factor for multiple diseases that are associated with stress. If you look at telomeres, the telomeres of caretakers are shorter than others because they are under stress, unfortunately. So definitely doing things that will decrease the stress and threat, so important. And yes, if you are a caregiver, and Maria Shriver has pointed out 65% of Alzheimer's patients are women, and 60% of caregivers are women. So, unfortunately, cognitive decline, especially Alzheimer's, which is by far the number one cause of cognitive decline, is a woman centric problem, whereas Parkinson's is more common, about almost 2 to 1, men than women. ALS, also more men than women. So it is a huge issue. And if you are a caregiver, please get yourself checked out, get on an optimal protocol. As I said earlier, we've not seen a single example of someone who started when they were asymptomatic and yet did the right things and yet developed dementia. Maybe we will someday, but we've not seen that yet. Remember that you are empowered. There is so much that can be done. It's not like the old days where people just say, wait for it, there's nothing we can do.
Yeah. Well, how do you overcome that though as a caregiver? So like if you are caring for a family member that, doesn't necessarily have that empowered outlook on their own health. They don't feel a sense of agency when it comes to their decisions and they don't feel like anything's possible. Like as a caregiver, what should they focus on? Because, I just feel like that can add to the stress when you're trying to put a square peg in a round hole. It looks like you're enjoying this episode so far. To get more episodes like this, double check that you've hit the follow button on your podcast listening app. And to get the cliff notes of this episode emailed to you the week this airs, go to meredithforreal.com. Okay, back to the show.
Yeah, so important. So here's the thing. Just realize that you're doing a wonderful thing by being a caregiver. It's one of the most important things you can do. You're helping others, but you are also hurting yourself. So it's just like several years ago, I was doing the usual, staying up all night, doing all the usual horrible things, eating the wrong stuff, doing all the wrong stuff, getting all upset. And so I was supposed to go on a TV show at like 5 a.m. It was a different time zone. And so I'm up till 3 a.m. getting ready and doing this and that and the other. I wake up at 4:30 with atrial fibrillation. First time I've ever had it in my life. So I found out I can't live that way anymore. It's not physiological. So recognize, if you're going to have fewer arrhythmias, and I haven't had any in a long time, doing the right things. And so recognize that as a caregiver, you are under stress. So you're going to have to take some time away from the caregiving. Think about something like heart math. Think about something like meditation. Think about there's lots of ways to do, feedback, to do even doing some just, square breathing. Help you. I can see my HRV go up, my heart rate variability go up beautifully when I just take some time off, relax a little. And you can even think about vagal stimulation if you like that, but get yourself into more of a parasympathetic mode and recognize that, okay, you're doing something for a very good reason, you're helping somebody, but you are driving yourself with some stress. And so you want to counter that. And then when things do go wrong, don't take it quite so seriously. Take it easy. Things are going to be better. The one advantage we have with all these chronic issues is that it's not a sudden change. You have some time to address these things. When you're treating pneumococcal pneumonia, you can be a few hours late and the person can die. So you want to get them on the antibiotic right away. When you're treating nervous system degeneration and suboptimal cognition and things like that, it's a marathon. You just want to keep taking it, take it one day at a time. Don't overwhelm yourself and just keep on working on things. See what works best for you. And it's just what you were saying earlier about exercise. Whatever you will do. Some people tell me I would never do meditation. Okay, then do heart math or do something different. Whatever it is. Listen to Brahms. Whatever it is that you like. Find those things and you can now measure it. Check your HRV and see what it does. And see how you do over time. So that's what I would recommend for the caregivers. And also, please, if you're a caregiver, get yourself evaluated, get on active prevention.
I love that. Well said. And I love that you gave Heart Math a shout out. We interviewed them
Oh,
a
good.
few months back. And so my audience, if they've been with me for a while, those that have been, they'll be familiar with that. And I'm going to put everything that we talked about, Cliff Notes, if you will, into my
Great.
email. So if you're listening to this or you're watching it and you want to be a part of that email, get like I took notes for you, so you didn't have to. You can go to meredithforreal.com. But I totally recommend getting the Ageless Brain because
Thank
not
you.
only is it so pragmatic, it's so full of hope, and you give F1 and Harry Potter analogies in here. I mean, it doesn't get much better than that.
I hear you. Thank you so much. Yeah. The take home here for me is there's so much that we can all do. And, don't be passive. Don't stick your head in the sand and assume that everything's going to be okay or that it's not going to be okay, because we really can be, empowered. By the way, there's this group, they call themselves the Alzheimer's Survivor Support Group. And these are people that have had, for years, have done very well and have sustained their improvement. We've recently published a paper showing people over 10 years of sustained improvement, which is unheard of before. And I noticed that so many people in the group are almost the same. They're all get it done. People are like, okay, we're going to do this. We're going to get in there. We're going to get it done. We're going to get our blood levels checked. We're going to do the right things. And it's really, really worked well for them.
I love that. Yeah. Community. That is an important ingredient for sure. Tell people where they can find your book and engage with your resources online too, because I did find that interesting that your book is so educational. It doesn't talk about anything that you sell. And then I went on your website and I was like, oh my gosh, this is like a one-stop shop for many of the resources that I would have had to dig the internet for.
Yeah. So what we're trying to do, it's always the same goal: best outcomes. What do we need? So the best of the best, ketone meter, the best EWAT, exercise with oxygen therapy that can be helpful. The best, if you want meals delivered to your home, the best in breed of each of these things. We're trying to make it available and trying to get the cost down, because this has been an issue. As the armamentarium grows, so too does the cost. And people are saying, well, go get stem cells for $50,000 and go get plasmapheresis for $60,000 and all these sorts of things, and HBOT for $60,000. So it can be expensive, but there's so much you can do for much, much less than that. And as one of the patients said, it doesn't take a lot of money, it takes willpower. So yes, get on the right basics, and there's so much you can do with those. So you can see it if you go to Amazon, The Ageless Brain, or the earlier books, The End of Alzheimer's Program, and the other one is The First Survivors of Alzheimer's. 7 people wrote their own stories about how they reversed their cognitive decline. They've done really, really well. All of them still doing well. And then you can go on drbredesen.com. Again, as I mentioned, go to mycqtest.com. It is a free cognitive test. See where you stand. When you're looking at then evaluation, there's 2 types of blood tests. There's where you stand and there's where you're headed. So your risk factors. And where you stand is things like p-tau 217 that are telling you what's going on in your brain today. The other ones are saying, what are my risk factors? High homocysteine, high hsCRP, genetic risk, all these sorts of things that are telling you, are you headed in the right direction or the wrong direction? So there's lots of places. I'm on Instagram, Dr. Dale Bredesen, and Facebook, and the usual X, Blue Sky, all those.
Awesome. Thank you so much for this conversation. Thank you for the work that you're doing and for giving everyone legitimate hope that they can not just live longer, but live longer and live well. So thank you.
That's the goal. Thank you so much, Meredith. Great to talk to you.
Thanks for listening. Since you've made it this far, I'd like to invite you to be a part of my private Facebook group. Unlike most of Facebook, which I affectionately call Gen Pop, this is an intimate group of curious thinkers who are kind and positive. There are plenty of opportunities to weigh in on what you want to hear about next, and I even do occasional giveaways. Search MFR Curious Insiders on Facebook or click the link in the show notes. If you liked this episode, you'll also like the one with the Director of Research at the HeartMath Institute, episode 285. You heard Dr. Bredesen mention this a few times, so it may be a great follow-up to this episode. And stay tuned next week for a remastered favorite when I talk with a man who used to live in the underground tunnels of Las Vegas. Until then, keep it curious.